So my question was, is the practicing defensive medicine ethical? Do either of you know what defensive medicine is? Okay, so it's when doctors choose to prescribe more tests or procedures that aren't necessary to the patient to defend themselves from malpractice suits. And a malpractice suit, malpractice first of all is when doctors perform negligible or illegal things on a patient that they shouldn't be doing, and then the patient is trying to get as much compensation as possible for that negligibility. And there are two types of defensive medicine. The first is positive, and this is unnecessary tests, overprescribing procedures, unnecessary hospitalization, and unnecessary treatment. And the second is negative, and this is when doctors turn down patients or procedures because of low chance of survival or a high chance of mortality, and a low chance of the procedure actually working. From my research, the first point I found is that it's not the best for the patient because it can cause more harm to the patient than good. One way is that it costs the patient more. If the patient has to do more tests or stay in the hospital longer, it's obviously going to cost them more because they have to pay for all those. It's going to make the treatment take longer because if they have to do more tests, it's going to take longer for the results to get back, and then they might have to stay in the hospital longer, which could prolong the treatment. And then sometimes they don't receive the care they need because, like I said, the doctors turn away patients that they don't feel like they need to treat because they have a greater chance of being sued due to the low chance of survival or procedure working. And then sometimes it can cause more harm than good because the overtesting exposes them to more radiation and everything that comes with all those tests. And then the doctors are in the end performing it to protect themselves. My second is that doctors fear lawsuits. So to avoid malpractice suits, the doctors practice this type of medicine, and they practice because of the number of lawsuits that are against them because of their malpractice. And as the uneducated, untrained, we are putting pressure on our doctors to be perfect, even though no one can be perfect, and we don't know what we're talking about or what they're actually going through. And then this puts too much pressure on the doctor. So to take some pressure off and defend themselves, they have to practice defensive medicine. And then my last point is that doctors knowingly practice it. So like I said, they're doing it to defend themselves because of how much and how often people go through with malpractice suits. And there are other factors that sometimes influence it, but in the end, it's just the doctor deciding to practice that. And not every doctor puts their own interests before the patients, but those that do, they're knowingly doing it and they're choosing to do that. And then it's just the doctor's final decision to prescribe these tests and extra procedures and everything, and even turn down patients. The doctors don't want to deal with that chance of getting sued because of how risky is the patient's procedure or sicknesses. And in the end, it's just the doctor's final decision to practice it. That's everything.